So in today's video we are going to discuss about the surgical instrument which are very informative and also very important in a competitive exam point of view. So must watch the video till the end. We will discuss all surgical instruments mainly in four categories. First category is cutting and dissecting instruments, clamping and occluding instruments. Third category is grasping and holding instrument, and the fourth category is retracting and exposing instrument. So let's start with our first category, which is cutting and dissecting instruments. So here is our first image in the category of cutting and dissecting instruments. So cutting and dissecting instruments are sharps and are used to cut body tissues or surgical supplies. So this is our second instrument named 7 handle with 15 blade deep knife. It is used to cut deep delicate tissue. As you can see in the handle of this instrument, the number 7 is written on this, so that's the reason it's named 7 handle with 15 blade. It means 15 number blade is fitted in this knife. Now this is the next instrument named 3 handle with 10 blade inside knife. It is used to cut superficial tissue. As I told you in previous instrument, same here, number 3 is written on the handle of this instrument and the 10 number blade is fitted in this instrument. And this is the number 4 handle with 20 blade. It means the 20 number blade will fit in this handle. And here also number 4 is written in the handle. You can see very clearly it is a skin knife and used to cut skin. Now this is the very important image. This image is of all different type of blades which are used in clinicals and in hospital setting daily. So you must know about all the different type of blades, their numbers. So these are blades for cutting, incisions and excisions, and you can see their numbers are written on the blade respectively. Now this is the image of the straight Mayo scissors. As you can see very clearly the image, it is used to cut sutures and supplies and also known as sutures scissors. Now this is the curved Mayo scissors. It is used to cut heavy tissue like fascia, muscles, uterus and breast. This is the medicine beam scissor used to cut delicate tissues. So till here we have completed our first category in surgical instrument. So let's come to our next second category, which is clamping and occluding instrument. So here is our first instrument in our second category, which is clamping and occluding instrument, named as a hemostat. It is used to clamp blood vessels or tag sutures. Its jaw may be straight or curved. Other names: krill, snap or stat. Now this is a mosquito. It is used to clamp small blood vessels. Its jaw may be straight or curved. As you can see the size of this mosquito, it is small, so you can differentiate this mosquito from other cutting or clamping instruments very clearly. So this is a Kelly. It is used to clamp large vessels and tissues. Its other name is Rochester pin. You can differentiate it from others instruments of clamping from its jaw. So this is the instrument named as Burlisher. It is used to clamp deep blood vessels, Burlicious have two closed finger rings. Burlicious with an open finger ring are called tonsils hemostats. Other name is Sknint tonsils forceps and Adson forceps. So you can differentiate this also very clearly. So this is a right angle. If you have watched my previous video about the obstetric instruments, in that I have told about the right angle retractor. So this is the instrument name as same. It is also a right angle, but it is used for clamping, and this right angle is used to clamp hard to reach vessels and to place sutures behind or around the vessels. A right angle with a suture attached is called a tie on a pacer, and other name is mixture. So this is the last image of this category, which is a hemoclip. Hemoclip applier with hemoclips applies metal clips onto blood vessels and ducts which will remain occluded. So now let's move on to our next third category, which is grasping and holding instrument category. And this is our first image from our third category, which is an Alice. It is used to grasp tissue. A jid Alice holds intestinal tissue, a heavy Alice holds breast tissue. And now this is the image of a Babcock. It is used to grasp delicate tissue like intestine, fallopian tube and ovary. We have also discussed about this Babcock in my previous video on obstetric instruments. And this is the image of a cocker. It is used to grasp heavy tissue, and it may also be used as a clamp. The jaw of cocker may be straight or curved, and its other name is Ostner, as you can see very clearly. And now this is the image of the Forester sponge stick. It is used to grasp sponges, and you can also call it as sponge forceps, and also you can call it as sponge holder. So this is the sponge holder. And I again want to tell you that don't skip the video if you really want to get some information. This video is very important from examination point of view. So now let's come to our next instrument. This instrument is a very important instrument. This instrument is not used in a particular surgery. This instrument is used in every surgery. It is a towel clip. It is used to hold towel and drape in place. Its other name is towel clip, and as you can see, its name is back horse towel clip. So it's very important instrument. These instruments, as you can see very clearly the image, are forceps, and these are available in various length, with or without teeth, and smooth or serrated jaw. Yes, these are the forceps. And this is the Russian tissue forceps, which is used to grasp tissue. And now come to our next beautiful instrument, which is Adson pickups. Are either smooth, used to grasp delicate tissue, or with teeth. It is also used to grasp the skin, and its other name is dura forceps. So this is the image of D. Bakey forceps, which is used to grasp delicate tissue, and particularly in cardiovascular surgery. And now it's time to learn about this image. This is the image of thumb forceps, which are used to grasp tough tissues like fascia, breast. Forceps may either have many teeth or a single tooth. Single tooth forceps are also called rat tooth forceps. Learn it. Rat tooth forceps and single tooth forceps. Many teeth forceps, top to bottom. Now can you appreciate this beautiful instrument image? This is Mayo Hager needle holder. Yes, It is Myohager needle holders which is used to hold needles when suturing. So friends, this was all about our third category of surgical instrument. Now let's move on towards our fourth and last category, which is retracting and exposing instrument in surgical instruments. So let's start. So this is the first image of our fourth category, and these are retracting and exposing instruments which are used to hold back or retract organ or tissues to gain exposure to the operative site. They are either self-retaining, stay open on their own, or manual, held by hand. When identifying retractors, look at the blade, not the handle. So I hope now you can differentiate these retracting and exposing instruments very clearly from each other. And now, if you remember this image, we have already studied about this in my previous video. So this is the Devers retractor. It is used manually. It is used to retract deep abdominal or chest incision, available in various width. And this is the Richardson retractor. It is also used manually, and it is used to retract deep abdominal or chest incisions. And our next image is an Army Navy retractor. It is also used manually, and it is used to retract shallow or superficial incisions, and its other name is USA or US Army. And this is a gullet. It is also used manually, and it is used to retract shallow or superficial incisions. And if you see very clearly this instrument, then you can differentiate now with the Doyne's retractor and this gullet instrument, and tell me what's the difference. And this is the image of a malleable or ribbon retractor. These are also used manually, and it is used to retract deep wounds and may be bent to various shapes. And now let comes to our first self-retaining instrument, which is Wittlener retractor, and it is used to retract shallow incisions. And this is our second self-retaining instrument, named as Gelpi retractor, and it is used to retract shallow incisions. And now this is our last and third self-retaining instrument, named as Balfour with bladder blade, and it is used to retract wound edges during deep abdominal procedure. Yes, this is the last image of this video, and you can see the image of this instrument very clearly. It is self-retaining. And at the last, I just want to tell you that study well, and if you really like my video, then subscribe my channel, like the video, and share the video in your friends, and please do comment so that I can improve my video what you really want in my videos.